So welcome to the next episode of the Explain series, and this is going to be a question and answer session on circumcision. Does it affect your risk of other infections? Having an intact foreskin does increase your chances of a urinary tract infection in the male, and this is usually in older men as a general rule, but it also affects your ability to contract other sexual infections. Okay, so I don't think it affects gonorrhea and chlamydia, but I know, for example, in HIV, for example, and human papilloma virus, which is HPV, which causes warts and cancer, these viruses and possibly other viruses, it does affect. So if you think about, you've got a foreskin, and underneath the foreskin, you've got your glands, and the tissues are nice and soft. If a tissue is nice and soft, they're more easily we're going to be bruised, and you're going to get micro tears. And so people with foreskins are more likely to be able to contract through sex viruses like the HPV virus or HIV, for example. In someone who is circumcised, yes, you lose your foreskin, but that toughening up of the skin on the glands of the penis is a little bit tougher. And as it's a little bit tougher, it is less likely to break, it is less likely to cause micro tears, and so there's actually a reduction in the amount of HIV transference or HPV. And as a consequence then, if an individual is less likely to get HPV and HIV, they are also therefore less likely to pass it on as well. There's also other things as well. So I mentioned about washing. If you don't wash, you can get a buildup of smegma. So smegma, as I said, is oily production which is mixed in with dead skin cells, and you get this waxy appearance. If it's left, it starts to smell, and it can smell a little bit, to put it bluntly, cheesy. And if it is continually left, it can also get infected as well, and that can be I've seen quite nasty infections which require a course of antibiotics. So retracting the foreskin and washing it is needed.